Today, I would like to share our local challenges on the boosting vaccination coverage. I think that all of us know that vaccines do not save life, but vaccination does save life. And the vaccination, together with other NPI, the non-pharmaceutical interventions, help to eradicate some diseases, reduce morbidity and mortality, and also protect the high-risk population. As a result, the healthcare costs and the outbreaks are prevented and reduced, and that can protect our healthcare infrastructure, and also produce herd immunity, social security, and to a larger extent, global health. So high coverage rate is more efficient for us. And today I'd like to review some of the local challenges we have faced in the past 5 years. And we review the measures we have taken in Hong Kong. And we'll just review some of the lessons we have learned. First of all, the challenge one is that some of us or in the population do not believe there is any need to vaccinate because some of the disease seemingly is quite mild. Many elderly mix up flu and flu-like illness. In the early phase of COVID, they think that there is just common cold. Especially in children, it seems to be mild at the case. And some of them think that measles is no longer present because they are waning. But the upsurge in US in the past 2 years, you see that that is not the truth. And even some of, a small percentage think that the measles protects cancer and protects their health because having measles means that all their congenital toxins are released. This is a misconception. But some of our patients think that it is not necessary because they have the personal experience of an eventful recovery after measles and chickenpox. Secondly, they think that the disease is okay, but their immunity is good enough. They have good natural immunity. They think their NPI are good enough, and some of them think that the alternative medicine and traditional medicine is good enough. And even some very prominent people think that the traditional medicine that is good enough to cure every disease. And they think that the vaccination effect is only short-lived, and also that some have the misbelief that when you get the infection already, you don't have to have any further vaccination. And even some of them thought that they had SARS before, and then that they are protected from the COVID. For all these reasons, then can be grouped under the effect that the lack of the up-to-date knowledge of the disease and lack of scientific support. And some of them may have misinformation that the COVID is only flu, and the misinformation that COVID can be treated by hydroxyquinolone and that it can be just by injection of alcohol. And that they have lack of knowledge about the natural immunity, and also the cultural misbelief that some of the diseases are good for them. The second challenge we find in Hong Kong is a vaccine concern and distrust. They think that the vaccines are not effective because some people still die and get sick after the vaccination. Then the vaccination protection is only short-term, and sometimes they think it's passive rather than active. And they have some idea that some of the vaccines might be harmful, such as thimerosal, aluminum, and linked with autism. And after one death case after HPV vaccination in the UK, they think that is harmful. And they misinterpret the data of worse. And also the past experience of swine flu and H1N1 introduction is horrible for some of them. And some of them might believe that too many vaccinations hurt the child, and they think that after the vaccination they can get the disease. They think that they might get influenza after the inactivated influenza vaccine, and also pregnancy is a concern for them. The vaccine distrust and concern is even worse for new RNA vaccine because they know too little, because They are too new for them. And the existing diseases, say they have allergy or chronic disease, they think they are not suitable, but that is not true in most cases. The effectiveness, uncertainness, not testing enough in children, potential side effect, well, possibly not quite certain in the early one or first phase or two, but longer after the first or two phases. And they have the misconception that COVID vaccine, the mRNA, can lead to infertility because they mix up DNA and RNA. And they also think that the vaccination during pregnancy is harmful. For long-term health impact, of course, we have to watch out for longer. And also, some of them have conspiracy, and there can be cultural misbelief, and also some of them think, say that after HPV vaccine, it will encourage the sexual activity of the kids, and they think that the MMR vaccines are produced continuously from the fetal cells, and also from the industry conspiration because the vaccine are coming out quite fast. And well, the reason for this vaccine distrust are that they have unrealistic expectation. They expect the vaccines are 100% protective, and they expect the protection is lifelong. And also they have, say, lack of knowledge on the vaccine. They don't know how vaccines work, and the antibody produced, and how vaccines are approved before their introduction. They have erroneous interpretation, or sometimes failure to consider the disease background rate. Say after the flu vaccine, a lady might end up in abortion, but they don't know that abortion is quite common as a background in the disease. They mix up the causal relationship and coincidence, and their past experience might affect also their mistrust. Then community say the vaccination rate also affect. In the media, they say that 10 people die of COVID, and 6 have been vaccinated. So they thought that the vaccination will cause more COVID death. But in fact, that was not true when the vaccination rate was already 90%. They don't know the preference rate. And also psychological factor, fear, denial, and also cultural belief. And in addition, political influence affects also their mistrust in vaccination. Communication is the third challenge we had. Other than the religious, the traditional medicine and the stigma, say that some people think that having the HPV vaccine means that they are having, say, quite a lot of sexual activity. And also trust issue, fear issue, the complexity of information, misconception have already been discussed. And the communication skill, we find that is lacking. Even from the healthcare professionals. Well, some of them might not be familiar with all the motivational interview, say dual, two-way engagement and something like that. And this can be difficult, especially for new diseases such as COVID. Of course, language problem and the idea of collective responsibility all affect the communication. Influencers, as I said, are two-bladed sword. It can be beneficial if, say, that the influencers and the professors are going in line with the government recommendation. But when the experts are having different opinion, the population and the community will be all at a mess. And also that we have quite a lot of nowadays, although social media has said that from overseas and also in Hong Kong, they will get quite a lot of information and misinformation. For some of the celebrities, they can be damaging to us too. And because they can be good influencers, but sometimes they aim only to gain attention and likes in their Facebook. And the information frame is easily read, but only viewpoint in a limited span of time. And the rating is unequal. They like to say that they quote some of the sensational messages and stories from their families, friends, internet. So they can give the erroneous impression. So social media is something that we have to deal with very carefully. The fourth challenge we get is the access, say the barrier. And so elderlies and people with mental disease, disabled people living alone are very important people for us to tackle. And of course, they're easier when they live in, say, in elderly or disability home. in COVID, quite a lot of people lost their job. So for adults, some of them still having the job, they have work long hours and difficult for them to get the vaccination, especially those living far away from the centers. Well, new immigrants for Hong Kong is a very special topic. Every year, over 20,000 coming in, and they say the vaccination schedule is different, and some of them having the communication problem, and also the misbelief, and also the disbelief. For domestic worker, the helper is another big problem in Hong Kong, because there are over 300 to 400,000 in Hong Kong, and their vaccination schedule at home is different from ours, and also that we have language problem dealing with some of them, and there's a reason why they say for MMR we have to advocate them to have review the status, because in Hong Kong the vaccination rate is over 90 odd, but in some countries might not be that high. And the other challenges, say the adherence to guideline in Hong Kong is easier, because we have only one the Department of Health giving the guidelines, so it's not too much a problem. In other countries, when the president and also the head of the medical department are having different opinion on the guidelines, and the cost effectiveness now, the government is studying, it's quite good. So and it's not too much a problem in Hong Kong, because the cost is borne by the government in the COVID or all other diseases. Complacency when the disease is not thought as bad as before in the first and in the last phase of COVID. And the vaccine supply, storage, scheduling difficulties are very important problems for coverage. But in Hong Kong, the government is taking part, so it's not a problem for us. Vaccine fatigue, especially after 1 or 2 years of confinement or vaccination, some of them have the fatigue and also the mental depression, especially for the elderly. So we have difficulty in convincing the elderly, especially those over 80 years old, they are having mental depression, and also that after the long confinement, and some of them think that they rather die than have the vaccination, because they want to die. Whether they have vaccination is not their problem. Funding is very important for most programs, but in Hong Kong the COVID one is all sponsored by the government, not for us. Political polarization, it might be the case, but because we had the social unrest in 2019, and that was quite the severe social unrest. But it seemed that after the COVID steps in, the social unrest was not too prominent. And the social and cultural injustice in Hong Kong was not evident. And the vaccine equity is not a problem for us. And the anti-vax activity in Hong Kong is quite low in the prevalence. So it's not too great a problem for us. So the challenges for us is, include on this part. So other than the challenges, understanding the vaccine hesitancy in Hong Kong, that is our part to motivate our population to do the vaccination. We'll act on the health belief model, and fortunately, the Hong Kong government had taken quite a strong intervention in our prevention. They set up 3 emergency response committees, advising our chief secretary, and also the Infectious Disease Committee and the Vaccination Committee. They jointly formed all the vaccination policy, and they coordinate all the other departments, including the Home Affairs Department and the Logistics. They connect with international and transactional collaboration. Funding, when they get the funding, they get buy the vaccine. We are fortunate that we have the vaccine, the COVID vaccine, as early as 2020. It's one of the countries, very few countries get it so early. We have the research and monitoring of all the disease vaccine, AFI, waste water, and all the social responses. And the vaccine purchase, storage problem, not that much a problem for us, because the government takes up all of them. And the education resources and campaigns for the public have been dealt with by the Department of Health and also the universities. We take a partnership with all the health professionals, and also we reduce all the access barrier, such as outreach clinics, multiple clinics, home visits, maternal and child hospital clinics, and the school vaccination program. We have also at the same time continue to promote the non-pharmaceutical intervention. Administration intervention in the form of vaccine pass and policy and legislation plays a very important role in boosting our coverage. And also we have to tackle the public. This is the website of our, so on the left side, where we'll see that the government the website on the vaccination, and that shows that also the vaccination not only for the the COVID vaccine, also influenza vaccine and all the other types of vaccines. When you press on the you'll see the COVID vaccine on the next page. And we'll see on the top, you can see that we have not only the Chinese and English, and also the different sizes. And also we have, if you can read it, you can see the languages. We get the Hindu, the Thai, and the Indonesia and the Vietnamese at the right upper top. We have all types of languages. And on the COVID vaccine, you can see where to get it, who to get it, where to. There are all the details downstairs in the vaccine stage. And in conjunction with the Hong Kong Pediatric Society, took the initiative in the 5th wave, and then we get all the webinar at that time, and the hit rate was over 100,000 at that meeting, and we get all the promotion and the full promotion, not only on vaccination but also on the disease. We'll talk on the disease, the symptoms, complication. We'll talk on the natural cause and also the collateral health effects of COVID, and the up-to-date figures. And from our real data, we can find that the most of those who die are unvaccinated persons, so that we target and modify our schedules so that we can target on the elderly, because most of the disease came from those over 70. And we'll also talk on the children, as children, because they have also the problem. We'll discuss on the MISC, and also we'll talk on the pregnancy having vaccination and the family herd immunity and long COVID. And also for this we can see that the immunity after the natural infection falls, and after the vaccination, it can boost up. So it means that even after infection, the vaccination still can help. It works together with the Chinese University, and we convert all the sports facilities into vaccination centers. We have 50 vaccination centers in Hong Kong, over only 400 square miles. And we'll go to different houses in case of the disabled children. We work with district community, and we'll ask the prominent people, say the Professor Sophie Chen, then the Secretary of Health, and the Secretary of the Home Affairs Department head, the Dr. Chen, and also Dr. Goh, the hospital authority head, to help the promotion. We ask that our friends from the HA to do some of the modeling. We talk on infectivity of also the vaccines, not only on COVID. Well, of course, we have to convince them of the COVID, the vaccine for all ages. We'll talk on before 5 years age, still quite a lot of data, and also for adolescents, they are effective in avoiding the critical disease. Even after Omicron comes up, then we'll give them the update data. And also that for them, we like to give the real data. They say that this in the US having the disease. And also that some people in Hong Kong are always concerned that whether they should have the coronavirus or the BioNTech. And this showed that if you get the 3 doses, it doesn't matter whether you get it or not. The coverage, we estimate, is over 80 to 90%. And the newer generation will keep them updated. Even you see the website today, we're going to give them more information on the JN1 COVID vaccine. And possible side effect, of course, we have to be honest to the patients, telling them all that. In Hong Kong, we have the safety monitoring of COVID vaccines in Hong Kong, which monitor all the AEFI, and we find that the vaccination, that the AEFI is only 0.04%, and this applies to almost all ages, all similar. But in Hong Kong, we find that after the COVID vaccination, that some of the adolescents have some of the myocarditis. And immediately that we reduce the dosage from 3 doses to 1 dose. But later we find that the 1 dose is not protective enough. And the research of the Canadian study that 2 doses are effective. And the side effect is less when they are spaced apart. So we modify our guidelines. So that one of our job is always to maintain our up to say the state of the art and the guidelines. We will also discuss on the vaccine safety evaluation, so that some people, when they worry that if they have say that the vaccine is produced only a couple of years, that they are still safe because they all passes the phases. This is a very good slide from the Ministry of Health in Singapore. It is very simple and tells you that for the COVID-19 vaccination, what to alert and what to not when to ask. Because quite a lot of people think that when they have allergy, some eczema, they refuse the vaccination. But they will show that it is safe in most cases after evaluation. And we like to prioritize our vaccine, and we find that those over 70 years of age have a high fertility ratio. And we'll also list our potential risk factor for them for prioritization. And to reduce the access barrier, we have the vaccination at school, child care, maternal and child centers, colleges, organization, around 5,000 odd private practitioners are participating in the scheme, and over 50 community centers are operating in Hong Kong. We arrange also the flexi hours. They open even on Sundays and public holidays. Also, we have outreach program for the disability and elderly homes. They have pop-up clinics and events, and the mobile center, walk-in center. For those who cannot travel and cannot come, we'll arrange some of the home visit. For costs, well, it's not a problem in COVID because the government bears it all. Some district center even arrange transportation for those elderly to get it. Incentive rewards in Hong Kong doesn't seem to work too well. For the first part, when they have the incentive of having, say, the lucky draw and also the money, they boost up the vaccination percentage for a short time. Afterwards, well, some people might expect more, but there is no more incentive. Then the vaccination rate doesn't go up again. But the reminder call helps. And on the right, you show that the vaccination schedule is converted from the community, the playground. And also on the left is a specialized pediatric venue for the kids, because they might be afraid during the vaccination. We have the home visit by the Secretary of Home Affairs, and also some of the volunteers joined some elderly who cannot come to our clinic. We'll say that together with other NGOs, that they will organize some of the events, talks, and also vaccination program, so to cut down the problem of language barrier and misbelief and cultural misbelief. We'll convince them that the vaccination worked, even for when you get the full dosage, it's protected for all ages. And this is one of the things that in Hong Kong, and a bit controversial at the start, but now later accepted by quite a lot, is a vaccination record, and also the Leave Home Safe mobile and vaccine pass. Without the vaccine pass, you might be denied entry into quite a lot of almost all restaurants and playgrounds and also facilities. Whether you like it or not, many of them have to go to the hospital or clinics. They have to get vaccinated, or otherwise they cannot go back to the colleges and also the university. So this is an administration intervention, and this is a very effective skill, but well, we have to say to be cautious because there is a little bit different from the mandate, say the vaccination. Well, when the disease changes, we change the policy, and this is the policy we have been changing, not every day, but whenever there is in need, and we'll change it to different age group and different, say, people. And we won't forget the influenza vaccine at that time, because when the COVID is prevalent, there are many people that just think of COVID and forget the influenza. And especially influenza prevalence rate at that time was almost zero. And after the, say that the COVID, it jumped back again. So we already reminded them to start it. Engaging healthcare professionals is very important, because we get the central role, because the healthcare professional is very important in for those, say, the people who have a bit hesitant, then they are very important. And the motivational interview, dialogue-based intervention are thought in some of the papers that raise up to 43% increase in the rate. And also the patient health record is very important, the vaccine pass. And these are the, say, the healthcare professionals' communication skill is a very important issue for us. And these are, well, of course, we have to say that a more in detail the training for them. So to conclude, the challenges we face in Hong Kong are very similar, I think, to the other parts of the world. Say they were similar in the confidence, in complacency, in communication, convenience, and self-calculation of the risk, and also the idea of collective responsibility. We are a little bit different well, we are fully funded by the government, and the government commitment in administration is very strong, and the logistic is very, say, the comprehensive, and the vaccine procurement is very successful. We got the vaccine in in the late 2020. One of the first few countries get it. Well, the difference also is because of it might be a little bit in the degree of similarity and the difference. Action taken, I don't want to repeat again, that these are the ideas that we have used. And I think that what we have achieved for, say, in the past years, we have achieved very good in the BCG vaccination and Hep B. All the traditional, we are over 95% commitment. Even though the pneumococcal vaccine, they are all funded by the government. So the government funding and intervention is very, very important, and to maintain a high vaccination rate. And for HPV, we introduced it in about 5 years ago, and for the P5 and P6, we also can maintain a 90% coverage rate. So this is very important. And for the COVID, it seems that we have quite successful. Actually, it's not quite, because we get overall the vaccination rate was quite high. But in fact, you can see in detail, you find that we get very bad result for the elderly, especially over 80 years old. And this is the lesson we learned, that because these are the target, and we have learned it by sacrificing 100 lives, 10,000 lives for that. Okay, and this is for this, well, superficially speaking, that they find that we get quite a good coverage rate. But for those over 80, we get 71%, but it came a bit late. It's only the latter part of the fifth wave. And we were successful to convince them after the fifth wave, the reduction in the mortality. And the coverage of seasonal influenza is lower than we expect, because in the 2022, the vaccination was low because they did not have to go back to school. And also the influenza was only almost 0% at that time. And now that we are gaining back our strength now in the influenza. For the elderly with pneumococcal, we are still a great, important job to follow. So the lesson we have learned that the coverage is comprehensive, multifaceted strategies important, and it is different from different countries. And the strong government involvement is beneficial for all of us. International collaboration, transsectoral collaboration is important. Of course, everything should be scientific based, otherwise difficult to convince people. Community engagement and also the healthcare professional engagement are important. We like to say that the effective tailored communication is important. You have to pay special attention to the vulnerable group, especially the elderly, over 70 or over 80. We have to watch out for the new determinants because they may change at times. They update the vaccination and logistic policy. A sustained action is important. Say for influenza, we don't sustain, then it will fall down. And we have still more challenges ahead other than the COVID and the traditional vaccine, because an RSV vaccine coming up, meningococcal vaccine coming up, and the HPV for the males, we have still quite a lesson to learn and to do.